Justwell Health Partners is a data-driven population health management organization providing business support to our physician partners so they can focus on their passion, the practice of medicine.
My name is Justo Luis Pozo. I was president and co-founder of Preferred Care Partners back in 1999 when we started the company. We grew the company over a 15-year period to 45,000 Medicare Advantage lives and 15 counties in the state of Florida. In 2012, we were lucky enough that United Healthcare came and validated our great work as an organization and purchased our company. After stepping down in 2013, I took a 5-year hiatus, but through that period, I stayed in contact with physicians, et cetera, and noticed that not much had changed. And in 2018, I decided to go back and reach out to a lot of the physicians that I was familiar with and kind of chat with them as to what their challenges were, which was a lot of them were the fact that they couldn't keep up the pace with the regulatory and the quality and the diagnosing measures that were imposed on them by the health plans, meaning they would have to create a business unit in these primary care physician practices, and simply they just couldn't do that. They're too busy practicing medicine, and they didn't have time to get into the business aspect of medicine, right? Which created the opportunity for Justwell Health Partners. Justwell Health Partners is a primary care physician network that the basic objective is to combine the practice of medicine with the business of healthcare. Over the years, the health plans have been requiring and pushing hard on the physicians to take on quality measures, basically a tremendous amount of regulatory burdens.
Working with Justwell may have been the best business move I've ever done in my life. For once, I have a management service organization that actually gives me data I can rely, I can trust. I have a group and a team who I enjoy working with, who has helped me and given me every tool I can to maximize not just patient care, but the revenue of my practice.
As a data-driven population health management organization, we provide clinical services to providers, enhance revenue cycle management, cost containment, and improve quality in value-based healthcare. Our analytics provide us with support on HEDIS measures to ensure our partners are in compliance and provide full transparent reporting to enhance their focus on the practice of medicine.
So the health plans are demanding and pushing hard the physician practices to really play a bit in the business side of it. The doctors are too busy practicing medicine. They don't want to do that. So the opportunity is us. So the opportunity for us to insert ourselves between the health plan and the primary care practice, both sides win. The health plan wins because we're enhancing diagnosis codes for them and making sure that they're documented correctly. The HEDIS measures are documented there, the quality measures are there, basically to help them in contain costs. How do we contain costs? Well, we contain costs through reducing readmissions. How do you do that? Through transitions of care. When the patient goes home from the hospital, we intervene as an organization with our nurses. We immediately communicate with that patient, and we make sure that when he gets to his house, he's got all the medical equipment he needs, whether it's a hospital bed, a walker, that his medicine reconciliation is there, and then immediately we provide and get and make an appointment with that patient with the doctor so he can have a quick follow-up. Why do we do that? To prevent readmissions.
A physician who insists on today's world and today's medical environment to continue to practice independently is navigating a ship blindfolded. He doesn't have the data, the administrative help. He can't follow compliance and all the HEDIS requirements. A physician needs to find a partner he can trust and align himself. It'll be a mutually beneficial relationship, both administratively and yes, financially. Doctors need data and they need administrative support that they cannot afford to pay for themselves. A physician that teams with a good managed service organization is guaranteeing himself a financial and stable future.
So a couple of the things that we do for the physician practices, and I think that's why they really depend on us, right? So when we identify a certain amount of patients that are critical or the most vulnerable, meaning somebody that may have a congestive heart failure, somebody may have diabetic or COPD or comorbidities. That patient has to be cared for in a different way. Therefore, we have complex case management programs depending on the acuity of that patient or its comorbidity that pretty much put certain protocols that we monitor that patient to make sure that they're taking their medicines, they're taking care of themselves, we're preventing them from being admitted to the hospital. Those are big savings, cost containment, the health plan benefits, the doctor benefits, the patients stay healthy, everybody's happy.
The advantage of a physician joining JustWell is that above all else, you're joining a team that you can trust. There are other service organizations a physician can align himself with. But with JustWell, you're aligning yourself with a team that has over 25 years experience in Dade County. They understand the business. They have a long track record of honesty. They provide extra help. They will help you set up home care for patients. They will help you identify troubled patients. They will give you monthly reports that will help you guide your practice, not just to provide better care, but to help your practice be more profitable. So out of all the service organizations that I have ran across, and I've been doing this for over 30 years in Dade County, I finally dropped anchor and settled on the beaches of JustWell Health. It is the plan that I've learned to trust.
Secure the future of your practice. Contact JustWell today and learn how we can manage the business of healthcare so you can enjoy the practice of medicine.